Commission de la santé mentale du Canada, Mental Health Commission of Canada.
My name's Ed Mantler, and I'm the Vice President of Programs and Priorities with the Mental Health Commission of Canada. The Roots of Hope project brings together a coalition of people within a community to work within the structure of the model and to look at promising and best practices from all over the place to design an implementation plan that's bespoke to their community. So looking at the strengths of their community, looking at the opportunities or the gaps that can be filled in. So it's not a cookie cutter approach. Every community develops a plan that's specific to meeting their needs. And so First Nations and Inuit communities that are participating in Roots of Hope have a model, have a plan that's really specific to the needs of their community. So it's really responsive to the local needs, and it's really engaging local people to take ownership of promoting life in their community. The MHCC has been so proud to be able to really develop this model, this Made in Canada approach based on experiences around the world, and to inspire 8 communities across the country to come in, to put their energy, their commitment, their resources towards developing their implementation plan, actually putting that plan in place, and working with us on the National Research Initiative to truly evaluate this model.
I'm Brian Machara. I'm a psychology professor at the Université du Québec à Montréal and director of the Center for Research and Intervention on Suicide, Ethical Issues, and End-of-Life Practices. My role in Roots of Hope is principal investigator for the research. All the Roots of Hope sites provided training. Usually there were all different types of training. There was programs training physicians to ask about suicide directly and assess suicide risk in people who are coming in for somatic problems, symptoms, upset stomachs, and other things like that, where these might be a symptom which was associated with their suicidal thoughts and getting help with a doctor and sort of feeling out what help is available.
Je m'appelle Céline Fortin, je suis coordonnatrice du projet Enraciner l'espoir pour le comté Madawaska-Victoria dans le nord du Nouveau-Brunswick. À l'intérieur du projet, nous avons collaboré avec des partenaires très importants qui sont très précieux pour nous, dont les municipalités. On a aussi eu des partenaires naturellement avec les professionnels de la santé, les gens en communauté aussi qui ont très bien répondu à nos activités.
One of the key factors in Roots of Hope that leads to its success is the continued involvement of various community stakeholders, people with lived experience, and really an attempt to have all the pertinent community members participate in both the planning of what activities would be implemented as part of Roots of Hope, and also have a role of continually providing feedback about whether or not they're on the right track, what needs to be modified or adjusted, and how people think about it and how it seems to be working.
I think one of the biggest successes has been actually bringing these communities together. So they're not working in isolation. They each have their own unique plan that's specific to their community, yet they can learn from one another and they exchange ideas and actually keep each other motivated. And, that community of practice will endure long after the Roots of Hope demonstration project is complete. And in fact, that community of practice is already growing.
My name's Ryan Murphy. I am the Manager of Prevention and Promotion Initiatives with the Mental Health Commission of Canada. One of the biggest challenges that we faced certainly was COVID-19. We really feel that it's important to go and meet communities a number of times a year, and that was something that we weren't able to do. And it certainly had an impact in terms of being able to meet communities when they're just starting out on their journey. However, we did find ways to adapt this to virtual environments, and we did smaller focus group sessions so that they felt a little bit more intimate, and found ways that we could connect virtually and more often than we would have otherwise.
I'm Brittany Howell, and I'm the research coordinator in Roots of Hope Burin Peninsula, which would be in Newfoundland and Labrador. It's been a challenging time, but I do think that Roots of Hope, the support from the community, has helped to kind of create, just to help create hope in a way to get us through it. So throughout all of this, we've had monthly meetings with the entire national group, and it's been very helpful because whenever we have challenges, we could bring them up and we could lean on each other for support.
My name is Alyssa Brewer-Singh. I am the Executive Director for the Waterloo Region Suicide Prevention Council, and my role within Roots of Hope is the project lead for the Waterloo Region side of the Waterloo Wellington project.
And I'm Cecilia Marie Roberts, and I'm the Manager of Community Suicide Prevention Projects for the Canadian Mental Health Association of Waterloo Wellington. And I'm the Implementation Coordinator for the Wellington side of Waterloo Wellington.
You know, COVID really impacted our ability to do the work because we were impacted in what we were actually able to do. You know, we certainly had calls to continue the work of suicide prevention within the community, but it shifted our lens, it shifted our ability to do the work.
Yes, COVID was probably our biggest challenge over the last couple of years, but it also created some opportunities, right? So programming that was not virtual before became virtual, and you know, that's something that we will continue moving forward, and I think that that's probably, you know, the bright spot in this whole thing. And we were also challenged to kind of do things a little different. I know in Wellington, you know, we launched postcards campaigns. I started a podcast. Is just something that I don't think we ever would have done if we weren't looking for creative ways to talk and engage the community. So
yeah, which was so important, right, to keep doing that work and just take a bit of a different approach.
In rural communities, sometimes there's thoughts that you have to be more silent about suicide, and it's something that you don't talk about. And there's the myth that if you talk about suicide, that it will incite other people to do it. But that's not true at all, and that's something that we really try to show in our workshops and our conversations, that it's important to talk about suicide.
My name is Danica Ward. I am the Community Suicide Prevention Coordinator with the Roots of Hope project on the Burin Peninsula. We really had to get the conversation going. We had to continue the conversation, find champions within the community, and through all of those means, we were able to break down some of the stigma that surrounds suicide.
Je m'appelle Dr Jbilou, je suis médecin spécialiste en santé publique et je suis chercheur et professeur au Centre de formation médicale du Nouveau-Brunswick et à l'Université de Moncton à l'école de psychologie.
Il y avait un défi aussi très intéressant, mais en fait c'est un défi qu'on a décidé de relever depuis le début du projet, c'est de travailler avec les hommes d'âge mûr. Alors, c'est une population qui n'est pas accessible, facilement accessible, c'est une population qui n'embarque pas forcément dans les services de santé mentale ou même la recherche en santé mentale. Et donc, ce défi a été un peu quelque chose qui nous a accompagnés tout le long. Mais ça ne nous a pas découragés, au contraire, ça nous a motivés. On a été chercher dans la littérature, on a vraiment regardé absolument tout, comment concevoir les interventions, comment même le langage, on a changé notre langage pour qu'il soit plus acceptable, plus attractif pour cette population qu'on veut cibler. Et on a réorganisé ou réévalué nos approches. Au lieu d'attendre que ce soit ces hommes-là qui viennent nous voir, nous, on est partis chez eux. Donc, on est parti dans la communauté, on est parti dans les milieux de travail où il y a une prédominance masculine. on s'est gardé une flexibilité de travail et au fur et à mesure qu'on mettait en place des interventions, on les ajustait, on s'ajustait au milieu, on s'ajustait aussi à la science. Il faut toujours avoir cette capacité d'adaptation, donc c'est absolument ce qu'on a fait dans le cadre du projet.
Some of our preliminary conclusions are that there was significant increases in public awareness and decreased stigma in many of the populations who were impacted by Roots of Hope. Roots of Hope successfully created a dedicated place for people implementing the programs across Canada in different sites to meet and exchange knowledge and ideas. This interconnection accelerated the use of research and innovation in establishing new suicide prevention programs.
My name is Wesley, and I'm a suicide prevention advocate. The project has helped me feel like I have something to give to society. It's helped me give back and turn my own lived experience of suicide into something meaningful. It's made me feel like I can help the people around me and do something unique and interesting that will have a lasting effect on my community.
My name is Nidika Ruwari. I am the director in the area of prevention and promotion initiatives, where we focus heavily on suicide prevention and life promotion at the Mental Health Commission of Canada. I think the biggest impacts from our perspective has been just the conversations that the Roots of Hope has sparked across the country. The ability for several communities to come together and have conversations on a daily basis or around what one community out in Saskatchewan might be doing and having a conversation with another in Ontario has been really magical to see. And I think more than anything, it's creating conversations that are coast to coast to coast, as well as a shared understanding of what a model and a framework around suicide prevention and life promotion could look like, and a common language that's getting developed throughout the country for a bigger and better impact.
Research and clinical experience indicate that talking about suicide in a non-biased, open manner and allowing the space for someone to talk about suicide is one of the most helpful things one can do in preventing suicide. Communicating that I'm willing to talk to you about what's really going on, even if you're thinking of killing yourself, is often best achieved by simply asking a question: are you thinking of killing yourself? No one ever says, oh my goodness, no, but thanks for suggesting it. It never happens. People understand this as an invitation to talk about something which is troubling them, and an openness on your part to engage with them, even though they are considering suicide, which is something they might be hesitant to share with someone else because they're afraid of your reaction.
Je dirais que c'est tous ensemble qu'on peut faire une différence en termes de prévention de suicide, et plus qu'il va y avoir de communautés qui s'impliquent dans ce type de projet-là, et plus que de connexion qui se fait au niveau des partenaires, au niveau des municipalités, au niveau des leaders politiques, c'est qu'est-ce qui va faire la réussite de ce projet-là. Enraciner l'espoir, ce n'est que le début. On commence le travail qui est fait, puis qu'on a créé, qu'on a innové, puis on espère pouvoir voir nos initiatives aussi se répandre à travers le Canada, que d'autres communautés adhèrent à nos initiatives aussi, puis le reste du Nouveau-Brunswick également.
Commission de la santé mentale du Canada, Mental Health Commission of Canada, commissionsantémentale.ca.